Have you thought about what anxiety really is, what is the cause, and what can be done? This very simple video shows the general causes of anxiety. Here's my own take of the triangle of conflict, adapted for use in primary care. I often show this version to primary care patients suffering from anxiety, stress, depression, etc. First, I draw a triangle. Here at the bottom, I write emotions. With emotions, I mean primary emotions, the true emotions, the first and natural response. For instance, if someone hurts you, your primary emotion will probably be pain or feeling hurt. But if you, for various reasons, do not want to show that emotion, you might respond with anger. In this example, the primary emotion is pain and the secondary emotion is anger. The anger is a protection or defense for feeling hurt. It could be the opposite. Your primary emotion could be anger, but maybe anger evokes some fear in you and you respond by crying. The fear and crying are then secondary emotions. It's really important to understand the difference between primary and secondary emotions since they have almost opposite functions. So when I write emotions at the bottom of the triangle, I mean primary emotions. Here I write the following primary emotions: love, which essentially is larger than an emotion; happiness, grief, pain, fear, and anger. Other emotions like guilt, curiosity, or disgust could be added, but now I focus on these 6 emotions. Here I ask the patient, do you recognize if any of them are more difficult to feel? Remember the answer. Now, love and happiness are pleasurable emotions, but grief, pain, fear, and anger are not so nice to experience. So why do they exist? I ask the patient, do you have any idea of the purpose of these emotions? Some respond by saying some emotions have a survival purpose, like anger and fear trigger fight or flight. Others might say the bad emotions make a contrast to the good ones. I would say that could be true, but in this context, the emotions have a different and very important purpose. The primary emotions are communication. Here I write communication above and to the right of the emotions. So what do the primary emotions communicate? They communicate our basic human needs, which we are born with and depend on until the day we die. Here I write needs to the right of the emotions. Love and happiness communicate the need for contact, relation, and sometimes attachment. This need for contact can take many forms: to be listened to feel understood, to be emotionally or physically or spiritually close, to be touched or emotionally moved by others, but also by nature, God, or animals, including pets. This contact has also an inner dimension, the important contact with oneself. Without this contact, life feels dull or dead, with no direction. Our life lacks meaning. When we lose this contact, for instance, if an important relation ends or if someone dies, then contact with this person is lost. We grieve. Therefore, grief is also a communication of this need for contact. Grief is a process of remembering the importance of that relationship and our need for contact. It is a process of accepting what is lost to be able to open up again for love, to others, or future relationships. Regarding pain, when you see someone in pain, I ask the patient, what would you like to do if you see someone in pain? Almost everyone answers, help that person. Yes, therefore pain communicates to others, but also to oneself. I need to be taken care of. The same goes for fear. It communicates the need for protection. Anger communicates settings, limits, stop, no, that's enough, etc., but also what is important to oneself, which often is our needs. Anger is also in the service of autonomy. Of course, anger can be misused and not in the service of our needs, but then it is most likely a secondary emotion, which functions as a defense. Remember, primary emotions are communication of our human needs. Secondary emotions are defenses. Now, since grief, pain, fear, and anger often are uncomfortable emotions, we do not welcome them. We might have experienced negative reactions when expressing these emotions. The result is that we have learned to use various defenses to push away these emotions. Now write defenses at the left upper corner of the triangle and draw an arrow from defenses to emotions, illustrating defenses pushing away the emotions. We can use many types of defenses, but simple examples are different types: distractions, or everything we do too much of or too little. We think too much or too little. We work too much or too little. We sleep too much or too little. We eat too much or too little, or we exercise too much or too little. More severe examples of defenses are substance or alcohol abuse. These defenses push away unwelcome emotions, but they also push away the corresponding needs. So, when pain is pushed away, it is harder to recognize and communicate the need to be taken care of. When anger is pushed away, it is more difficult to recognize and communicate the need for proper limits and communicate what you need. Since it is hard or impossible to choose to have just some emotions, like happiness, if we could, then we would choose to feel happy and love all the time. When we push away the negative emotions, we also push away the positive emotions and our need for contact. Then our lives become dull and less meaningful. We become cut off from ourselves and others. Since our basic human needs are so important to us, deprivation can have severe effects on humans, and excessive usage of defenses or neglect of our emotions and needs is almost like trying to dismember a part of ourselves. The body reacts with anxiety. Now I write anxiety in the upper right corner of the triangle and draw an arrow from emotions to anxiety. So instead of feeling our emotions and needs, we now have anxiety. This anxiety can be low-level, barely noticeable, or more severe. Anxiety is of course uncomfortable, so we try to push away or escape the anxiety with the same methods we use to push away our emotions. We rely on our defenses, but it didn't really work for the emotions, and it does not really work as an escape from the anxiety either. We use defenses to try to push away the anxiety, but it becomes a battle between anxiety and defenses. Draw two arrows in opposite directions between defenses and anxiety. This battle creates internal stress, which can add up to external stress, and it can continue for many years if not addressed, and result in exhaustion or depression. When you have arrived at this stage, with stress, anxiety, exhaustion, or depression, you might wonder what have happened. It is the result of having learned to neglect your emotions and needs. Now I ask the patient, can you relate to this picture? Now take a short break and let this message sink in. The majority of patients respond by taking a photograph of it, since it makes more sense to them than other models I've shown. Almost no one want to take a photograph of other models like the Clark's panic circle, the CBT5 factor model, SOBC situation analysis, etc. I believe the reason is that this is a relational model incorporating emotions and human needs, which means something to them. To this date, I have shown this model to approximately 1,000 of patients. Now it's the time to address comments from the patient. Here is some additional information. You can make it even clearer to the patient that anxiety is a signal that something is wrong and the usual behavior have to change. More important. Anxiety is not your enemy, it is the last warning, the last outpost in the service of emotions and needs, which have to be understood. Depending on the response or what kind of problem the patient presents, several steps can be added. If the patient is self-critical, having negative automatic thoughts or self-attacks, overthink or worries too much or is plagued by shame, then write these above the defense corner of the triangle. Explain that these function as defenses that push away the emotions and needs. Guilt in the form of self-attack belongs to the defense corner, but the deep guilt that is related to love or attachment can be placed among the emotions at the bottom of the triangle, even though this form of guilt might be more related to fear. Core beliefs can also be added at the defense corner, since they are deeper layers of hindrances for the patients. If the patient have presented panic attacks, social anxiety, general anxiety, etc., put these above the triangle as a result of a prolonged internal fight between defenses and anxiety. The same goes for mood swings or emotional dysregulation, often mistaken for real emotions. If the patient expresses lack of direction, explain that emotions are the internal compass that guides their life. If the patient expresses lack of motivation or energy, explain that motivation, motion, and emotion share the same etymologic root. Emotion can be seen as the fundamental driving force in life. As examples of human needs, it is possible to add the needs listed in the schema therapy model. Anxiety can be understood as a freeze reaction with stress activation in the sympathetic autonomic nervous system. Or in other words, anxiety can be understood as a contraction combined with stress reaction. It is full throttle with full brakes at the same time. Imagine what happens to a car driven this way. Agency, self-efficacy, the power to originate action, is lost in anxiety, and without contact with emotion, direction in life is also lost. Of course, an external hopeless situation will also result in anxiety, but this will not be solved by psychotherapy. Acceptance may not be possible without taking care of one's needs. Grief is the process of letting go and might be a necessary precursor to acceptance. Inner peace can be understood as something that happens when true needs are fulfilled and there is a deep contact with oneself. It is homeostasis, balance, and contact.